Good evening. Millions of people have irregular heart rhythm. Their hearts either beat too fast or too slow. This can be nothing to worry about, or it can indicate a serious problem that could lead to sudden cardiac death. This is the #1 cause of death in the United States. The normal heart beats 100,000 times a day, an incredible number. Those heartbeats are necessary for blood to circulate to our body's organ and tissues. Today, we are going to visit some of these arrhythmias and how to manage them to help you understand the problem and best ways to deal with it. We will talk to our expert, Dr. Yusuf Kanjawal. Welcome back. It's my pleasure again to go back to cardiology. And today, it's my pleasure to welcome our expert in electrophysiology, Dr. Yusuf Kanjawal, who is experienced in doing a lot of studies and dealing with arrhythmia when it comes to heart problems. Yusuf, thank you for being here.
Thanks for inviting me, Dr. Kabour.
Today, we are trying to focus on the arrhythmia problem. Too many patients talk about palpitation, fluttering, arrhythmia, and I think we want to shed the light about the one of the common problem, which is including irregular heartbeat. And so before we start, I want you to give us in a simple way to the public, what's the definition of arrhythmia? What's arrhythmia?
Correct. Dr. Kabour, as the word itself denotes, that arrhythmia is basically an irregular heartbeat. Normally, a person, for that matter, beats 70 to 80 beats per minute, and it's regular from the upper chamber to the lower chamber. So there is a regularity, there is a constant relation between the upper and the lower chamber. When either of the chambers becomes out of sync with the other chamber, it can lead to arrhythmia, and the most common arrhythmias come from the upper two chambers of the heart itself. But the arrhythmias can be from the lower chamber as well. And that's why the arrhythmia by definition itself is an irregular, bizarre heartbeat, which could be either regular or it could be irregular.
A normal heartbeat rate and rhythm is called normal sinus rhythm. The heart's pumping action is driven by electrical stimulation within the heart muscle. The heart's electrical system allows it to beat in an organized, synchronized pattern. Every normal heartbeat has 4 steps. Step 1. As blood flows into the heart, an electrical impulse from an upper area of the right atrium, also known as the sinus node, causes the atria to contract. When the atria contract, they squeeze the blood into the ventricles. Step 3. There is a very short pause, only about a fraction of a second. And step 4. The ventricles contract, pumping the blood to the body. A heart normally beats between 60 to 100 times per minute. Electrical signals in your heart can become blocked or irregular, causing a disruption in your heart's normal rhythm. When the heart's rhythm is too fast, too slow, or out of order, an arrhythmia, also called a rhythm disorder, occurs. When your heart beats out of rhythm, it may not deliver enough blood to your body. Rhythm disorders can be caused by a number of factors, including disease, heredity, medications, or other factors.
So the most common arrhythmias do come from the upper chamber of the heart, the 2 upper chambers. And out of those, the most common is atrial fibrillation, which primarily comes from the left upper chamber of the heart. If you see patients coming out of the hospital, the most common rhythm diagnosis in them is atrial fibrillation. Then there are some what we call regular types of fast heartbeats, which can come either from the right side or from the left side. Patients can either acquire it or they can be born with it, like an extra wire. So this is what we describe as regular versus irregular fast heartbeats. Now, from the bottom chamber, you can have arrhythmias, what we call ventricular arrhythmias. They mostly are regular, or they can be just simply what people describe it as a palpitation in the form of a single extra beat, what we call PVC, or premature ventricular contraction. Patients who have got heart attacks, they can develop scar in the heart itself on the left side particularly, and they can start developing very fast, sometimes very irregular fast heart rates, usually ventricular tachycardia, which is a regular fast rate coming from that area, or it could be a very irregular, bizarre fast heart rate, which we call ventricular fibrillation, and usually the patients don't make it to the hospital when they go into VF. So the types are, as I mentioned, coming from the upper chamber, which could be irregular, coming from the bottom chamber, which could be irregular, and as you rightly asked, which is the commonest form of is atrial fibrillation.
This animation will show some of the most common types of arrhythmia. Click the navigation arrows below the animation screen to play, pause, rewind or fast forward the animation. Your heart is a muscular organ which lies in the center of your chest. Your heartbeat is controlled by electrical impulses, which travel across the heart, making it contract. The atria contract first, sending blood into the ventricles. The ventricles then contract, sending blood to the lungs and around the body. Nerves supplying the heart change the rate at which impulses are sent across the heart muscle to meet the needs of the body. In atrial fibrillation, the electrical impulses in the atria become disorganized, overriding the heart's normal rate and rhythm. This causes the atria to quiver or fibrillate. The irregular impulses can be transmitted to the ventricles, causing the heart to pump irregularly and too fast. In supraventricular tachycardia, or SVT, the irregular electrical impulses pass across the ventricles and back up into the atria in a circle, rather than travelling from the atria to the ventricles in one direction as they should. This makes the heart beat faster. In ventricular tachycardia, abnormal electrical impulses are produced in the lower chambers of the heart. This causes the heart to pump faster than normal. The ventricles may not have enough time to fill up with blood properly, so less blood is pumped around your body. In heart block, the electrical impulses that control your heartbeat are slowed down or blocked as they travel through your heart. This can result in a slow heart rate. In ventricular fibrillation, electrical impulses start firing from many different points in the lower chambers of the heart, very rapidly and in an irregular rhythm. This makes the heart quiver and unable to beat properly. Ventricular fibrillation is fatal without prompt treatment.
So what are the most noticeable symptoms or feeling the patients have when they develop these fast heartbeat, regular or irregular? It doesn't matter. I mean, is it the same or it's a little bit different?
It is a little bit different in two populations. Those people, let's talk about atrial fibrillation, for example. The people who notice atrial fibrillation, they feel palpitations, they feel tiredness and fatigue. They may get short of breath. And ultimately, if the patient is not got back to the rhythm, and if the rate continues to be fast, ultimately the lower chamber of the heart actually may become dilated, or in layman's term, it can fail. And patients can actually go into heart failure, and then they will develop swelling, shortness of breath, and swelling in the feet and face and all that stuff. As far as the regular heart rates are concerned, they can be absolutely abrupt in onset, means they just take you by surprise. And there may be some people who may say that when I bend, they get up and they go into this very fast heart rate, and they have learned how to stop it by actually holding the breath, or as if you are, sort of exerting very, very deep, or take a deep breath, as if you have to go to the bathroom, some kind of, that maneuver they use. and then it stops sometimes. So those are regular. But irregular beats can be absolutely very, very troublesome to the patients because of the fatigue, palpitations, they feel short of breath, and their activities of daily living really suffer a lot.
So most of the symptoms coming from the heartbeat abnormality leading to abnormal heart function, exactly, which is leading to all of the symptoms in a simple way.
Absolutely.
So when when we get some of those patients in the hospital or in the offices, and we try to deal with it on the minimal basis, and then we find ourselves maybe we have to send it to our colleagues like you who are expert in electrophysiology. So can you define to us what is electrophysiology? I mean, when we tell the patient we're sending you to our electrophysiologist, what does that mean? I mean,
yeah, that's a very important question because a lot of people in general public do not know exactly what this electrophysiology is. When a patient comes to me and I tell them I'm an electrician, and like you are a plumber for that matter, and electrician is basically the specialist who deals with the electrical department of the heart itself. What basically it is, it starts from where the electrical beat starts, and through different wires, it comes from the upper chamber to the lower chamber, and that's how we coordinate our heartbeat from upper and lower chamber. The electrophysiology is basically, it's a subspecialization which deals primarily with these arrhythmias, which we already described. And then patients who actually have these symptoms, or you document them on the EKG, or you also document them, let's say you give them something what we call Holter monitor when he comes to your office, and we document some arrhythmia. Sometimes they will have to go to get this electrophysiological study done. In layman's term, we call it EPS, electrophysiological study. It's like heart cath, but in your case, you go through the artery. But in our case, we go primarily through the veins, which is even safer. Sure. And we do put small wires, which are the tip of the ballpoint pen, different wires on either side, into the heart itself and into different chambers. Okay. And then we actually tickle from outside with a stimulator, we call it, and we put you into that particular fast heart rate which you had clinically, which you came to your office, the patient came to your office. And then we just sort of map it and find out where this circuit is, abnormal circuit. So different rhythms have different circuits. And what will happen is we sort of map it, make a road map, and then another wire we go, and we go to that particular point or to particular circuit, we zap it, and the abnormal rhythm is eliminated at that time.
So the bottom line when we are talking about electrophysiology, and I want to emphasize on that they are cardiologists trained, extra training to become expert when it comes to electrical system of the heart. So it's not really just an electrician the way you suggested, as much as it's really far advanced knowledge when it comes to the arrhythmia. So really when we are not able to manage the minimal arrhythmia problem, which is we see it on regular basis as general cardiologist or as family doctor or internist, usually we send it to the expert who are specialized in these stuff because of their expertise in detecting these arrhythmia and try to manage it medically or invasively by doing some of the other technology which we are going to talk about. Which is bring us really, we're going to talk about some other arrhythmia later in the future, but today I want to concentrate on the atrial fibrillation, which is becoming a major issue because it's a complicated problem. You mentioned atrial fibrillation as irregular heartbeat or irregular arrhythmia. Do you mind to tell me how frequently we see that problem, number one, and what is the most common causes we see atrial fibrillation in those patients for?
That's a very good question, once again. And as I said, the most common arrhythmia in all the patients who are admitted to the hospital or who come to your office, most of them have atrial fibrillation. There are around 3 to 3.5 million Americans who have atrial fibrillation. And in 2025 to 30, the number is supposed to double. So it is going to be like an epidemic of atrial fibrillation. The question is, what is the most common cause of atrial fibrillation? In the United States, high blood pressure is the most common cause of atrial fibrillation. In the rest of the world, it's usually the rheumatic valvular disease or the valve disease, rheumatic heart disease, which is the most common cause of atrial fibrillation. So high blood pressure is number one. But there are other conditions which actually predispose you to atrial fibrillation. And one of them, which we have as an endemic or epidemic, is sleep apnea, the obesity. And then we have got, sometimes we do try to exclude whether the patient has got thyroid problem or any other electrical problem. There is a group of patients who have absolutely no cause. I mean, these are the guys who are relatively younger and they don't have hypertension, high blood pressure, they do not have sleep apnea, they don't have thyroid problems, they once in a while go into AFib. We call them lone atrial fibrillators. So there is no cause, okay? Then there are people who actually go into AFib, we call it holiday heart syndrome. Like people, young guys who go for a drink, there's a beer, they go for a binge, and all of a sudden they will go into atrial fibrillation. But that's a transient phenomenon, usually they will come out of it.
And this is the syndrome which we see it. Most of this patient comes on Monday after having watched a quite few games on Sunday, football games, and they are coming in the morning on Sunday having that palpitation or irregular heartbeat. That's why it's called holiday syndrome, which is luckily it's something reversible and easy to treat.
Is your heart clock ticking?
We love French fries. G3 looks the same, but each makes a difference for your health. This large fry at a typical fast food restaurant has 500 calories and 25 grams of fat. This small fry has 230 calories and 12 grams of fat. This fry comes from the grocery stores, 160 calories and 6 grams of fat. So, which do you choose? Because remember, time waits for no one.
Why become a foster parent?
I wanted to give back.
I wanted to help a child.
It's something that I felt called to do.
We heard about the need and we knew we could do it.
We missed having kids in the house.
Being a foster parent just fits with our family.
I'm Dean Sparks from Lucas County Children's Services asking you to become a foster parent. Call us at 419-213-3336, visit us at lucaskids.net, or find us on Facebook.
Atrial fibrillation, or AFib, is a heart condition that causes the heart to race and beat in an irregular rhythm. People often say that when they have an episode of AFib, they feel as though a fish is flopping around in their chest, or that their heart feels like it will explode. AFib can increase your risk of heart failure, stroke, and even death. Because of these risks, and because AFib can get worse over time, it is important to have it diagnosed early and cared for appropriately. AFib is the most common type of irregular heartbeat, or arrhythmia. It affects over 2.5 million people in the United States alone. Your heart is a muscle that acts like a pump. With each beat, it squeezes or contracts to push blood to the rest of your body. Your heart has 4 chambers. The 2 upper chambers are called atria. The 2 lower chambers are called ventricles. Under normal conditions, the upper and lower chambers of the heart work together to pump blood throughout the body. The bloodstream enters the atrium where blood is pumped to the ventricles in a regular and coordinated way. From there, blood is pumped from the ventricles to various parts of the body. A healthy heart beats in a regular, steady rhythm or pattern. Notice how the heart beats evenly and uniformly. In a healthy heart, electrical signals travel through the heart in a regular pattern, as seen here. These electrical impulses originate in a special section of the atrium and travel through the heart in a regular pattern. Each signal ultimately causes the heart to beat. In AFib, the top 2 chambers of the heart, or atria, beat very fast and in an irregular pattern that is out of rhythm. Notice how the atria appear to quiver and are uncoordinated. Due to this irregular pattern, the atria do not coordinate with the ventricles, and the heart is out of rhythm. AFib occurs when electrical signals start in the wrong place and misfire. The faulty signals cause the atria to quiver and not contract completely. Notice how the signals spread in a rapid, disorganized way. Your doctor may perform a test called an electrocardiogram or an EKG to see your heart's electrical activity and rhythm. During an EKG, small electrodes are placed on specific parts of your arms, chest, and legs using small stickers. When the heart beats, the electrodes send signals to the EKG machine. The EKG measures the electrical impulses or waves shown here as lines. See the differences between a healthy heart and a heart in AFib? In a normal heart, beats are evenly spaced and show a regular pattern. In AFib, the waves appear more chaotic and random. While the causes of AFib are often unknown, there are a number of things that increase the chances you might get it. Some of these include age, family history, smoking, high blood pressure, or hypertension and obesity. Also, if you have any of the following conditions, you're more at risk of AFib, heart failure, diabetes, or coronary artery disease. The more of these risk factors you have, the more likely it is you might experience AFib. Be sure to discuss your full medical history with your healthcare provider. AFib often gets worse as time goes on. It's important to take care of it early because the longer your heartbeat is out of rhythm, the harder it is to return to normal. In this chart, the red lines represent AFib episodes, and the blue lines represent times when the heart is in rhythm. When many patients are first diagnosed, they experience periods of AFib that may come and go. These episodes may be momentary or last for days, but generally go away on their own. This is called paroxysmal AFib. In some situations, AFib may not go away on its own. Your doctor may need to perform a procedure or provide medicine for a cardioversion to bring your heart back to normal rhythm. This is called persistent AFib. In some people who have had AFib for a long time, the heart may not be able to return to a normal rhythm at all. This is called permanent AFib. Notice that over time, the red areas are larger and more frequent. This is why it's important to talk to your healthcare provider to be sure that you're doing all you can to keep your heart in rhythm.
Now, when it comes to the atrial fibrillation, there's a lot of fear when we tell the patients you have atrial fibrillation, and there's a reason for that. Do you mind to tell us why is the patient should be concerned when they have atrial fibrillation?
Correct. Number one is the most devastating complication, atrial fibrillation, which is an irregular heartbeat, can cause is a stroke. How does a stroke happen in these patients? Because of the irregular and bizarre contraction of the heart itself, upper chamber, the blood gets stasis, or it just sort of does not move the way it should move. And what it does, it forms a clot. So when the patient goes back into rhythm, there is a pretty good chance that this clot will come out and will go to the cerebral circulation in the brain and cause a massive stroke. So stroke is the most devastating complication of this unfortunate problem. It's a nuisance, basically. This we call nuisance arrhythmia. Besides that, if you don't control it very well, your quality of life, as I already said, Dr. Kabour, is going to suffer because you get short of breath, you feel tired and fatigued all the time. And it's very interesting. You must have seen so many patients in your practice. When you get them back into rhythm, they'll tell you, oh God, why didn't I get back into rhythm before? Because they feel so good once what we call the synchrony between the upper and lower chamber is maintained. Sure. So that's another thing. As I said, if you don't control the heart rate itself, ultimately it is going to lead to the heart failure. And what is going to happen is that the lower chamber is going to get bigger and bigger and bigger, and ultimately you will get into what we call congestive heart failure, and obviously that is almost the end result of this atrial fibrillation. That's why we always stress upon that they should consult the doctor, the cardiologist, and they should try to control their heart rate, absolutely. And then because of the fear of this clot and because of the fear of this stroke, and they need to have blood thinners.
There are many signs and symptoms of AFib. Many describe an uneven, flopping, or racing heartbeat. AFib can make you feel lightheaded, dizzy, or even short of breath. Some people feel tired or weak. Others experience chest pain or discomfort, such as palpitations. These symptoms might be subtle or severe, and they may come and go, and you may not experience any symptoms at all. In fact, 60% of patients don't even know when they're having an AFib episode. If you have AFib, it's important to know that while you may not feel symptoms all of the time, your heart may still be out of rhythm, and you're still at risk for other complications like remodeling or stroke. If left untreated, AFib can change the size and even the shape of your heart through a process called remodeling. Remodeling can cause permanent changes in your heart in a very short amount of time, potentially just a few days. Because of AFib, your heart has to work much harder, and heart tissue can be damaged. Notice how the heart increases in size and its walls thicken. Even if you're currently being treated for AFib, it's important to understand if your management program is addressing all the risks associated with the disease. During AFib, blood can collect or pool in your heart and cause a clot to form. If this happens, the clot can travel from the heart to the brain and cause a stroke. If you have AFib, you're 5 times more likely to have a stroke than someone who doesn't have it. It's important to talk to your healthcare provider about your risk of stroke and how to reduce it. You may feel exhausted and weak as a result of your heart not pumping properly. While some people with AFib may be able to lead a normal lifestyle, in some cases, having AFib can keep you from enjoying exercise and everyday activities. If you have AFib, you're 4 times more likely to end up in the hospital 3 or more times than those who don't have the disease. It's important that you continue to talk to your doctor about managing your AFib, even if you are not currently experiencing symptoms.
I really appreciate it. I think we educated the patients enough today, and we're going to see you again and again and talk about different other arrhythmia problems. And I really appreciate it, and thank you very much.
Thank you for bringing me in.
Thank you.
Appreciate it.
After listening to Dr. Kanjawal comments and discussion about heart rhythm problem, I hope you have enough knowledge about dealing with this problem. But always remember that when you have irregular heartbeat or palpitation or arrhythmia problem, please talk to your doctor. Talk to your family doctor, who I always call him the captain. Talk to your cardiologist and try to understand your problem, because understanding your medical issue, it will be the best way to deal with your medical problem. It's so easy to deal with that problem when you are able to understand the problem. For that reason, remember that this is our goal, is to educate you, to improve your knowledge, at the same time, try to improve your quality of life and live a happier life. Because remember, time waits for no one.